And maybe now it's a good idea to take some questions, some thoughts from our friends.
So there's a question how to differentiate dermatitis and urticaria as symptoms can be very similar.
They can be quite similar, actually, dermatitis and urticaria, and sometimes they can also be together, actually. Yeah. Shruti Singhal asks, how Zincum is different from carcinosin? Um, they can look very similar. Thematically, situationally, if you think carcinosin child also is dominated, Zincum child also dominated. Zincum also works hard. Carcinosin also works hard. Zincum also conscientious. Carcinosin also conscientious. But what is the difference? The difference is Zincum is hyperactive. The Zincum is the difference is Zincum has constant state of anxiety. The difference is Zincum has this twitch jerk constant. The difference is Zincum goes into a brain fag. The difference is Zincum, the nerves are very often affected. In carcinosin, the feeling is they have to take a lot of responsibility and they have to go out of way. They have to put superhuman efforts to do something beyond themselves. There is not that kind of anxiety. In fact, carcinosin in a lot of anxiety can look very calm and emotionless. So that's a lot of difference. Zincum will be restless. His feet will be like this all the way. Carcinosin, no. Carcinosin will be very calm. In fact, you'll ask, are you okay? Are you okay? Sab theek to hai? And carcinosin will be like this. Okay. I've seen carcinosin patients in the worst diagnosis. They'll bring the reports to you, and you will start sweating, and you'll be like, wow, this is very difficult disease for a young boy. And they'll be calm, smiling. This is carcinosin. Zincum is not like that. So in this way, you have to differentiate very, 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 very kind of subtly.
So next question is the short symptom like dream, which is unique, should be considered first, or the physical symptom should be considered first as an entry point in the case.
Depends on what is the type of case, what is the type of symptom, and how intense the symptom is. I'll just give you an example. Now, in today's cases, you saw that the physical symptoms weren't so prominent, and something much more deeper was very, very prominent. So you want to focus there. In some other case, in another case, for example, that I might have seen, the physical symptom is prominent, right? There is a case of kind of urticaria, better by putting vinegar, right? So the remedy is totally different. What's the remedy? Maybe someone in the chat can write. Urticaria better by vinegar application. Uzma asks, with any software we are using, will repertory course help? Absolutely. The repertory course is not about software, it's about books. The Kent repertory, the Boric repertory, the Nair, the Clark, the Boger, the Fatak. This is what you're going to learn. And also, participants will be watching this. We are trying to organize if you can get a very special discount in if you don't have a software to get it. So that also we are trying to organize. I cannot promise you right now, but we are trying to organize.
So Dr. Varsha Thakkar asked, what is the role of histaminum in controlling intolerable itching?
Histaminum. Wow. So I'm trying to see if one last session I can take on sarcoids and nosodes. So I'm going to attempt to do that, uh, hopefully. Histaminum is a very important remedy for not just skin but in general, and it's a remedy of today's times. Hmm? And to understand histaminum, you have to also understand sarcoids. Sarcoids have this state, all sarcoids, including thyroidinum, histaminum, cortisone, adrenal cortex, dopamine. The main theme of sarcoids is a state of constant positiveness, a state of constant wanting to do something. So they are constantly very, very active, very, very restless, very, very impatient, constantly wanting to do things beyond themselves. This is something that you'll see on all sarcoid remedies. And typically in histaminum, you will see a lot of restlessness and impatient. So there is a very beautiful rubric. Restlessness cannot wait. Wait cannot. And restlessness wants to walk. So this is something that you will see in Histaminum. And when you see this state, when you see this state, then the any problems that the patient have, including the skin, will improve. So this is the idea that, you know, Calcarea is a very good remedy for fibroid if the patient is Calcarea calf. And that's what I want you to know. So I'm going to show you this rubrics of Histaminum. I'm opening it for you. Let's see this. Restlessness during waiting. Restlessness waiting ameliorated long. Restlessness walking ameliorate rapidly long. Very interesting. These are the rubrics of Histaminum. Okay. Very, very interesting remedy. We'll talk a little bit about nosode, sarcode, and skin disorders, hopefully towards the end. Huh?
So there's a question regarding external application of mother tincture can be used like urticurins in case of urticaria initially with indicated remedy or echinacea to reduce the itching.
I haven't used external application of urticurins till now. It's not in my experience. Echinacea, I always tell you, I've used a lot for local application for cleaning the wound along with calendula. And these are the two very important local applications. In the past, I have used in injuries, I've used Terminalia arjuna a few times. But when there is a very good approach that we have, we can give the medicine internally. Why we have to think locally, except for in particular cases.
So Catherine asks, can you say something about Zincum and autoimmune diseases?
Yeah, Zincum could often be a very important remedy for many autoimmune disease. One of the also reasons for it is a lot of suppression in Zincum. In Zincum, one of the important thing is a lot of suppression from vaccination, suppression from disease which has not totally erupted. And these things can often get suppressed and in future formulate autoimmune diseases or also sometimes brain related diseases. That's why Zincum is one of the very lesser known remedies that we normally don't think about.